Have you ever wondered how our brains learn to tell the difference between sounds like P and B, or S and F? It is a critical skill for developing clear speech and understanding language. This ability, known as speech sound awareness, starts with how well we hear the world around us. Ear infections, especially those that happen frequently or last a long time, can indeed impact a child's speech sound awareness. This happens because the fluid buildup in the middle ear can temporarily muffle sounds, making it harder for a child to hear the subtle differences between various speech sounds. The primary reason for this influence lies in the mechanics of hearing. When an ear infection occurs, particularly a type called otitis media with effusion, fluid collects behind the eardrum. This fluid acts as a barrier, dampening the vibrations of sound waves as they travel from the outer ear to the inner ear. Consequently, a child experiences a temporary, mild to moderate conductive hearing loss. Imagine trying to listen to a conversation underwater. It is difficult to distinguish individual words and sounds clearly. Because of this muffled hearing, the brain receives a distorted or inconsistent auditory signal. It is then challenged to accurately process and categorize speech sounds. For example, a child might struggle to differentiate between similar sounding words like cat and pad or pin and pen. This lack of clear input during critical developmental periods can delay the development of phonological awareness, which is the ability to recognize and manipulate the sound structure of spoken words. For parents, this means being attentive to signs of ear infections and their potential effects. Observe if your child frequently asks for words to be repeated, if they seem to turn up the volume on electronic devices, or if their speech development appears to be slower than that of their peers. Regular checkups with a pediatrician are important, especially for children prone to ear infections. If you have concerns about your child's hearing or speech, consulting with a speech-language pathologist or an audiologist can provide clarity and guidance. The good news is that this type of hearing loss is often temporary and improves once the infection resolves and the fluid clears. However, consistent and prolonged periods of muffled hearing during early childhood can create a disadvantage. Early intervention is key to ensuring that a child receives clear auditory input, which is essential for building a strong foundation for speech and language development. By promptly addressing ear infections and ensuring proper hearing health, we support a child's ability to accurately perceive speech sounds. This clear perception is vital for developing excellent speech sound awareness, helping them confidently navigate the world of communication, both in listening and speaking.